Meanwhile, Delhi breaches the 10,000 mark for the fifth consecutive day. The state has now recorded 16,699 fresh cases in just the last 24 hours, with 112 deaths, which is the highest since the 23rd of November last year. With a spurt in cases now, Delhi's positive rate stands at an all-time high, 20.2%. Delhi Lieutenant General will review enforcement with DP. In fact, the MCD and commissioners today. Adding further to capital's COVID woes, as many as 388 Delhi police personnel have been tested positive. Amid the rising cases, Delhi Chief Minister Arvind Kejriwal has imposed a weekend curfew beginning from 10 p.m. today until 6 a.m. on Monday. Only essential services will be allowed to remain operational, while hotels, spas, gyms will remain closed. People who are scheduled to attend weddings will be given an e-pass, a special pass only for movement during the curfew, only to attend the wedding. As cases continue to soar in the national capital, Delhi government has now tightened the noose around violators. Over 2,400 people have been booked for violating night curfew norms on Thursday. Let me take you through some of those frequently asked questions over the Delhi relock. We're looking at a weekend lockdown now in Delhi. Few questions that people ask. Can at all a person travel during the lockdown? Yes, you can, but only for essential purposes. For all you know, a cop might just stop you and ask you questions on where you're going. Can a person buy groceries? Absolutely, yes, you can buy groceries. It's allowed. Now, we're looking at, is eating at restaurants allowed? A frequently asked question. Not allowed, because we're looking at a weekend lockdown where only home delivery will be allowed. Will cinemas be functional? Now, cinemas during the weekends will be completely closed. During the weekdays will be functional at 30% capacity only. We're looking at malls. Are they going to be open or not? Absolutely not. Malls will be closed until the 30th of April. Now, can a person order from e-commerce site? Well, you can order from e-commerce site, but only essential items will be delivered. Now, can I go to the gym or spa? Unfortunately not. All gyms, spas will be shut until the 30th of April. Now let's take a quick look at the COVID situation from across the country.
Karnataka yesterday recorded the highest number of cases, over 14,000 cases recorded, and this is the highest since Jan 2021 is what we are told. Bangalore alone has recorded more than 10,000 cases. So the government has now called an emergency meeting at 9:30 this morning, and I'm coming to you from the health minister's house here, residence, and he also visited private hospitals yesterday to take a status check as to how many beds have the private hospitals allocated. 50% is the number that the government has told the private hospitals to make sure it's mandatory to give to the patients who come out here. Karnataka also has called an all-party meeting on the April 18th, 4 p.m. to see the opposition's opinion and then take up further action. The sources within the government are saying this, that the government is contemplating on weekend lockdown, just say the same way that Delhi and Rajasthan has implemented. Karnataka too, there's all chances that this might be implemented is what we are told. But however, an emergency meeting has been called now, and there's election also in Karnataka tomorrow. 3 by-elections in Karnataka. Till now, the chief minister and other ministers were all in the constituency campaigning, but now the COVID numbers are on the rise, and health minister too has taken a status check from the hospitals and from the control room yesterday. 14,000 odd cases in Karnataka, 10,000 odd cases in Bengaluru, and it's a high time that the government acts is what the people on ground are believing, and hence 18th is the all-party meeting. We'll have to wait and watch if some big curbs is coming in the way to Karnataka. Nagarjun Dwarkanath for India Today.
For the last several days, on a daily basis, more than 5,000 cases of coronavirus were being reported out of Rajasthan, and the numbers at the various testing centers have also gone up. You can see at this CMHO center, the number of people who have turned up for getting themselves tested. There is a huge line which is currently there to ensure that the testing can get done. And there have been several complaints also of people mentioning that there have been delays of more than 72 to 96 hours of people test reports being given to them.
जो हम सैंपल भेजते हैं वहाँ कोई मशीन की प्रॉब्लम भी हो जाती है कई बार, तो मोस्टली तो टाइम पे आ जाते हैं, 24 आवर्स में ही आता है, कभी कभी लेट हो जाता है.
तो टेस्टिंग जो बड़ी है उसकी वो भी कारण है क्या?
वो भी कारण है. पहले से प्रेशर ज्यादा है, ड्यूटी टाइम तो यही था लेकिन पहले 5 से 5:30 तक फ्री होते थे, अब तो 7-8 ही बजते हैं.
That the reports of coronavirus tests come timely and if needed, so that people can get the required treatment in time, so that the spread of the virus can be limited. With Nikhil Sharma, Devankur Vadhavan in Jaipur, India Today.
COVID situation in Mumbai continues to remain grim. The count of active sealed buildings in Mumbai now stands at 1,100. The count of containment zones now stands at 95. The active cases in Mumbai are more than 85,000. And the biggest problem being encountered by the officials and administrators in Mumbai is the need for medical oxygen. BMC has now appointed 6 officers that will coordinate the supply of the available oxygen to the various hospitals. At the same time, more than 60 nursing homes will also be given the training as to how to use the available oxygen in an economical and judicious fashion. But amidst all this crisis, the good news for Mumbai and Maharashtra is that the central government has now given Mumbai-based Hafkin Institute the permission to manufacture and produce Bharat Biotech's Covaxin on transfer of technology basis. But the overall condition in the financial capital remains very grim. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
The second wave of COVID-19 had worsened the situation in Uttar Pradesh with 22,439 active cases found in last 24 hours. The total tally of active cases in Uttar Pradesh has gone up to 1,29,000. And as far as deaths are concerned, 104 deaths have been recorded in 24 hours with the total number of 9,400 in Uttar Pradesh. Certainly it's a big challenge for the government to control the virus spread in the state. For that, the night curfew timings have been increased from 8 p.m. to morning 7 p.m. a.m. At the same time, school and colleges have been closed and the UP board exams have been postponed for the next date. Also, on the other hand, the situation in hospitals is very critical, lack of beds, and at the same time, testing, which the government is claiming to have maximized by the day, is not evident on the ground. Certainly, in the coming days, as the numbers are increasing, it's going to be a serious situation in UP with the infection getting the widespread in the state in last few days. In Lucknow, with cameraman Harish Kantpal, Abhishek Mishra for India Today.
As coronavirus cases is seeing a sharp, unprecedented rise in the country, we're going to take you through details of this R factor, which is now our center focus. The R rate, which means the rate of infecting others. I'm going to take you through a recent survey that suggests at least 5 states that's looking at a serious rate of infecting. Let's start with Bihar. 1 person can infect up to 3 people. That's the rate of infection here. The rate of infecting others is what has been established. Uttar Pradesh, 1 person can infect up to 2 to 3 people. It's at 2.82%. And Assam, again, we're looking at 1 person infecting at least 2 to 3 people at 2.77. While you have Jharkhand, 1 person able to infect at least 2 to 3 people, again 2.31% in Jharkhand. Delhi also same, at least 2 to 3 people can be infected with 1 person showing positive. The national average on the whole of the rate of infecting others is at 1.57%. We're looking at an alarming rise in COVID-19 cases, and this survey really leaves us a lot to worry about. We're looking at shortage in beds, hospital care facilities. Let's hope that people follow protocols in place. All right, we're looking at serious rise in COVID cases across the country. At a time like this, COVID protocols have been put in place, stringent action taken against those violators. Meanwhile, the state of Uttar Pradesh is now facing twin challenges: the rising cases of COVID-19 on one hand and the return of migrants, mostly from Maharashtra, on the other. India Today team visited Lucknow's Charbagh station and Alambagh bus terminal to see if at all those returning home are currently being tested. Here's what we found.
As COVID cases soar in Uttar Pradesh, the state is staring at an even bigger problem. one that could see COVID numbers rise menacingly. Many of its people, laborers in other states, are returning, and that's an added worry. Most of them are coming from Maharashtra, the epicenter of the latest wave of the virus. An India Today team found the lone testing counter at Lucknow's Charbagh station was stretched to its limit as train after train brought more people.
हमारे पास 2 थर्मो स्कैनिंग है। अगर और ज़रूरत पड़ती है तो वहाँ दूसरा जो छोटी लाइन वाला है वहाँ भी हेल्थ डिपार्टमेंट की टीम लगी है, वहाँ से थर्मो स्कैनिंग मशीन मंगा लेते हैं। लेकिन 2 से मैनेज हो जाता है क्योंकि एक लाइन इधर लग जाती है, एक लाइन उधर लग जाती है, तो 2 से इजीली हो जाता है।
दुगना चौगना ही हुआ है सर।
कहाँ से पाए जा रहे हैं? महाराष्ट्र?
सर महाराष्ट्र है सर, अधिकतर लोग तो अब हर जगह से पाए जा रहे हैं। थर्मल स्कैनिंग होती है, थर्मल स्कैनिंग करने के बाद फिर इसके बाद ये हमारे एलटी भाई है, ये जो है अपना टेस्टिंग करते हैं, यहाँ नाम नोट किया जाता है, एड्रेस लिखा जाता है, पूरा बायोडाटा पेशेंट का किया जाता है।
The Alambagh bus station is the busiest in Lucknow. Buses leave this terminal not only for UP's interior but also for many states. But there is no provision for COVID testing here.
यहाँ पर आप देख रहे हैं जो स्थिति है, आपको लग रहा है कि इस समय स्थिति बहुत खराब हो गई कोरोना?
हाँ, स्थिति तो खराब है बट सेफ जर्नी नहीं है।
डर लगता है क्योंकि घर जा रहे हैं, कहीं संक्रमण
है वो पॉसिबल है।
There were others too who were worried that they could catch the virus on the journey.
मैंने कई बार कोशिश की, मुझे भी लगा कि हाँ बस स्टैंड जा रहा हूँ, शायद मेरा कोविड टेस्ट हो जाएगा या हम वहाँ पे थर्मामीटर लगा के कुछ भी करेंगे, लेकिन ऐसा कुछ भी नहीं है। आप खुद ही देख रहे होंगे अपनी आंखों से कि जितने भी यात्री हैं, जितने भी हैं, इसमें से आधे ने तो मास्क नहीं पहन रखा है और कोई जांच नहीं है। गवर्नमेंट मतलब इसको लेकर कोई भी एक्शन नहीं ले रही है।
कोई टेस्टिंग तो ऐसा नहीं हो रही है। मैं दिल्ली से आया, अभी कल रात में बैठा, अभी पहुंचा हूँ, तो भीड़ भी है और बहुत क्राउड है। सब मास्क वास्क का भी जहाँ तक का जब तक बाहर है तब तक है, बस के अंदर वहाँ पहुँचने के बाद मास्क वास्क भी कोई नहीं पहन रहा है, ना सैनिटाइजर की कोई ऐसी सुविधा है, वहाँ पे कोई प्रिकॉशंस नहीं है, वहाँ भी कोई टेस्टिंग नहीं है।
Officials at the bus depot admitted there were problems, but they said they were helpless as far as testing went.
थोड़ी सी प्रॉब्लम है और वो उनको इन्फॉर्म्ड है, तो वो लोग उन्होंने भेजा है, श्योर किया है कि वो भेजेंगे।
The UP government has specifically laid out guidelines to be followed for workers returning to the state. But the situation on the ground is very different. The lack of basic facilities for testing means many could be carrying the virus as they head to their villages. Bureau Report, India Today.
Hi everyone, Preeti Chaudhary here. Hope you like this video. For latest news and analysis, like and subscribe to the India Today YouTube channel. And don't forget to press the bell icon to stay updated. Thank you for watching.